Hello there, I'm Dr. Khalid Karim. I'm a Senior Clinical Teaching Fellow at the University of Leicester and work for Leicester Partnership Trust in England. Today I'd like to talk about autism spectrum disorder. Autism spectrum disorder are increasingly recognised problems in children, and they appear to have been growing in number in the last few years. They tend to affect boys more than girls, with girls going underrecognised. And they are called neurodevelopmental conditions, which reflects an abnormal development of the brain. Basically, autism spectrum disorders break down into certain core features. The core features being difficulties in social interactions, difficulties in communication, and difficulties in social imagination / rigidity of thinking. If we look at these individually, difficulties in social interaction can be quite significant. For example, a child might not want to interact or may be a bit socially inappropriate and you feel a bit intimidated by their close contact. They may not pick up on the social rules of how to behave around them, and this can cause quite a lot of embarrassment to anyone working with them. In addition, the children have problems with communication. For example, they may have difficulties in expressing how they feel, expressing anything, but also listening and using things such as gestures. For example, lots of people talk about children with autism having poor eye contact. This is not entirely true. The children don't really give their messages, like talk to you with their eyes and appreciate looking at your face. I think that communication is a probably under-recognised area, as it should be understood that many children don't really understand what's being said to them, and you may have to check their understanding. In addition to this, we call their other difficulties social imagination. This is the ability to predict what is going to happen to them later. So they have difficulties almost putting themselves in the position of where they're going to be, hence a social imagination. However, many children also have problems with imagination, such as pretend play, and have a rigidity of thinking. Now, the rigidity of thinking can be part of the autism, or just may reflect that these children feel very scared about what's happening in the world around them, as they have difficulties with socialisation, communication, and the social imagination, and therefore they like the routines and rigidity as it makes them feel safe. And there are other things which affect autism, such as many children have learning disability, and these may be explored in a further video.